It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, folks, I got good news for you and I got bad news for you, okay? Let me give you the bad news first. The bad news is that in our area, the rate for colon cancer is high, okay? That's the bad news. The good news is we have a great solution for you. We have many things that we could do to prevent colon cancer. And that's our theme of the show today, colon cancer in northeastern Pennsylvania. And who better to come on the show to talk about is Dr. Harvey Hotchner from the Oncology Center up in Lehigh Valley and on the Beltway, and also Dr. Michael Mahoney, who is a surgeon. I think you're going to find it quite interesting. I remember when we did this show a while ago with Dr. Imula when we were at the hospital. We had a person who called about 3 or 4 months after the show and said to me, Mr. Lesante, I want you to know you saved my mother's life. And I said, why? She said, because she saw the show that you did about colon cancer, and she went for a colonoscopy, and guess what? They found something, and thank God she went. So we're hoping that you pay attention to today's show. It's for your health. And as you know, folks, I'm the biggest baby that walks the face of the earth, okay? And if I could go for colonoscopy, it's a piece of cake. I'm telling you, it's a piece of cake. All right, let me welcome Dr. Harvey Hotchner. Am I saying that right, Doctor?
That's correct.
Okay. And well, you're an old pro at this, Harvey, right? I mean, you were on the show before, right?
Yep, so I think it's the third time.
Third time. I'm not paying you, Doc. That's it, okay? And you're not being a co-host either, okay?
Okay.
All right. Dr. Mahoney, thanks for coming on the show, okay? Well, anyway, I mentioned the fact that we're high in cancer, colon cancer in northeastern Pennsylvania. As to why, I guess we really don't have an answer to that, correct?
Correct. We have general things we can look at, we talk about, but there's nothing specific for Northeast Pennsylvania.
Why do you feel the rates of colon cancer are higher in
Well, the studies have shown that the risk factors are, number one is to have previous colon cancer. Number two would be if there's a family history of colon cancer, if somebody has colon cancer at an early age, probably less than 45. And the next reason would be the Western diet, which is high in fat and low in fiber. Alcohol plays a role, and probably those are the main. And one of the new factors is people being too sedentary, not getting around. Studies have shown that the amount of time you spend in a chair or in bed, it has an adverse effect, risk factor for multiple diseases.
When you say the diet, okay, some people, like to eat, maybe steaks or different kind of fatty foods. What should they be eating as well? I mean, what are some of the balanced things that people should be doing with their diet?
Well, you're trying to, it's like watching cholesterol. You want to keep your cholesterol down and your fat intake down and increase your fruits, vegetables, and fibers.
And when you say be active, what do you mean?
The studies. Actually now you can buy a desk with a treadmill built into it, because the studies have shown if you're standing up, it's a better lifestyle and less risk of diseases. There's actually studies going on in cancer. People already had cancer, and they put half the people are they give activity, and half they have sit or they try to act, and it's shown that if you're active, that your cancer risk or your recurrent risk decreases.
All right, so we have age groups here, okay? You said if there is a predominant colon cancer in the family, certainly you should be going a lot sooner for your colonoscopy, correct?
Correct.
Yeah. So that's key. It's the same with breast cancer. It's the same thing. But in general, if you haven't had it in your family, when is it the first time you should be able to say, look, let me go for a colonoscopy?
And the other thing I didn't mention is this inflammatory bowel disease is a risk factor, ulcerative colitis and Crohn's disease. If you're in general risk group, is recommended first one at 50. If you have you're in a high risk group, it depends if you have a genetic disorder, something called Lynch syndrome. You start at in the 20s. So somewhere between 20 and 50 depends on. It's certainly individualized, and the GI doctor would be the one who would tell you when to come back for your repeat colonoscopies.
All right, so we have a risk factor, the fact that if you've had cancer, colon cancer in your family,
Right.
you should get,
Screened earlier.
screened earlier. When you say earlier, in your
Probably in
20s?
the 40s.
40s, okay.
Right.
All right. Now, when you're talking about, is there any average age? I mean, is there an average age where it's predominant? In other words, what I'm saying is like of the percentage. Is it like between 50 and 55 or 60 and 60? I mean, or is
No,
it?
you see it you see it at any age. There is no particular.
There's no basic age group.
No, you can see it from people in their 30s up till 80s.
When you hit a certain age, if you're 75 or older, okay, should you still be going for colonoscopy?
I think if you've had colonoscopies and they've been negative, you probably have to. It's hard. I mean, there's no real cutoff, but 70, you may not need any more colonoscopies.
That seems to be
Right.
if you haven't had it at that time, even because you've already had a lifestyle, you're living
Right.
that
I mean,
life.
because what you're looking for is not cancer, but you're looking for polyps. Polyps are the precursor for malignancy. So if you get the polyps out early, you won't have a malignancy.
Well, that was the thing with this lady that I mentioned, when I did the show, because I have you doctors on all the time, and I hadn't gone for a colonoscopy, and then go and so on, because I'm a big baby and fear. It was like a piece of cake. I mean, it's nothing to it. I mean, even the preparation is even easier this time. I think when we do these shows, it's a matter of prevention. Trying to get people to react. So when you have these, if you have a diet that is high in fat, okay, is that you're saying that?
No, anybody should have a colonoscopy at age of 50, regardless of your diet.
Okay.
So
Period.
it's an increase. If you look at people who had cancer, you look at, if you do studies to show, well, maybe they have a higher increase of fat intake, but I don't think that is the only risk factor. Risk factor is just having a colonoscopy at age of 50, regardless of your lifestyle.
There are some people that are very stationary. I mean, they don't get out because of maybe whatever illness
Right,
or okay. So they sit and watch the Sam Lesante show all day.
Mm-hmm.
Okay, but they're watching television and they don't get around. What advice do you have to them? I mean, to be active.
Well, it depends on what other medical problems you have also. If you have heart disease or lung disease and you don't have that mobility, but like I say, it's not the cause, but these are always done in retrospective studies. You look at somebody who has colon cancer and you ask people these questions and then you try to put the data together. So it's not like you can do a controlled study and have half people sitting and half the people not sitting and see who has more colon cancer. So these are all retrospective analysis. So we don't have there's no a correlation between these risk factors and having the colon cancer. You already have the colon cancer. We look at what your lifestyle is, and then you come to some general conclusions. So everybody who is 50 years old should have a colonoscopy, at least a baseline.
So probably what you're saying is a person's lifestyle is really important. I mean,
It's important in your general health.
Yeah.
I mean, it controls your cholesterol and your heart disease. If you smoke, and you're going to have lung cancer or other medical problems. So it's just the lifestyle in America probably has an impact on, your overall health.
Is there a certain amount of fat percentage, for example?
I don't think we have that kind of.
You don't have that statistic.
No.
But the thing is, how do you reduce it? You reduce it by your lifestyle and,
Well, have a healthy diet, and, like I said, control how much meat you eat, increase your fiber, increase your vegetables, your fruits. Yeah, so all that has a good impact on your general health.
Someone who is going for a colonoscopy at 50 years old, what's the rate of saving them from colon cancer?
Well, if you find a polyp and you take it out, your risk is decreased. I mean, it should be zero at that point. Like I said, it takes the general evolution of a polyp takes about 4 to 5 years if it's left in place for it to become malignant.
Okay.
So it depends on some people. Can form polyps quicker than others. I think that you have a colonoscopy at 50, and they may tell you to come back in 4 or 5 years, and to see if you have another polyp. So that's sort of individualized based on your polyp formation. If you didn't have a polyp at the 50, your likelihood of getting another polyp is probably less.
What are some of the symptoms that you would have? What would be some of the symptoms?
Well, if you have a polyp without, you can have a polyp without any symptoms, and usually that's a very good thing.
Yeah.
If you have more advanced problems, you can develop, you can have change in your bowels, you can have diarrhea, you can have constipation, you can have blood in your stool. If you're bleeding above, you can have black stools. You can have weight loss, have abdominal pain. So it depends on what stage of the history of the cancer is. But in general, you want to find it before you have any symptoms.
So, I mean, again, the very important factor is when you're 50 or older, you should definitely
get
be
a
getting
screening colonoscopy.
And I mentioned before, I remember the very first time I went, which was years ago. You know, it was a little different in the preparation, okay?
Right.
Because the procedure,
Done better.
yeah, they've got a lot better. Okay, so there should be no excuse for that. Go ahead.
There is an alternative, but is less. There's a thing called virtual colonoscopy.
I heard about that.
Where it's still the same prep, but they're using a CAT scan to look at the inside of the colon. The advantage is if you have some kind of medical problem, you can't undergo the procedure, you can get a picture. But the disadvantage would be if you had a polyp, you would still need a colonoscopy to have it removed. So it's sort of, and most insurance companies may not pay for it at this point, but still a colonoscopy, or they could also do a sigmoidoscopy, which is looking at a shorter segment. But colon cancers have been moving further away from the rectum. So doing just a sigmoidoscopy isn't probably adequate to rule out all the possible sources.
What I can't understand sometimes is the fact is that when you're asking the public to do preventative medicine or preventative to get better, okay? The insurance companies, I would think, should want to pay for that. Because if something should happen, it's going to cost a lot more than having a regular test. You assume that. So I guess sometimes you guys...
colonoscopies are covered by insurances.
Yeah, cover insurance. Folks, I'm talking to Dr. Harvey Hotchner from the Lehigh Valley Physicians Group, and if you'd like to contact anyone to find out what's going on, the number is very simple, 570-5014, L like in Lehigh, V like in Valley, H like in health. And we'll be more than happy to give you some information. It's very important that you get your colonoscopy. But what happens if you do have it? You know, how is it found? You know, what would be a stage if you're not going for your colonoscopy, but you're getting the symptoms that Dr. Hotchner said? What happens then? We come back, we'll talk to Dr. Mahoney, and he'll fill us in on that. Stay with us. Welcome back to the Sam Lesante Show, folks. At the beginning of the show, I said that we have got good news for you and bad news. The bad news is that in northeastern Pennsylvania, the colon cancer rate is up. The good news is it certainly can be prevented, okay? But before we get to my guest, remember, if you want to watch any of our shows, all of the health shows we have, go to ssptv.com. My email is sam@ssptv.com. And remember, we're in HD, so for those of you who have an HD set, you can just go to 513 and you can see us in our full handsomeness that we have here to offer you. My guest today, Dr. Harvey Hotchner. You liked that, didn't you, Harvey? That was pretty good.
That was good.
Yeah,
like
you know, high D makes you look a lot better. Okay, Mike, and Dr. Mahoney. Now, Doctor, first of all, nice seeing you again. Okay.
Good to be back.
Second time on the show, right?
Yes.
Harvey has you beat by one.
Yep.
Okay,
Yep.
sorry about that. So you're located at the Health and Wellness Center, right?
Yes, that's where my office is, and I also work out of the main hospital.
Right. So we're here again. We're talking about colon cancer, and so how do you know if cancer is found, and how do you know what stage it would be in? Well, let me ask you before you get to that. Okay, they've already had a colonoscopy, correct? Or do you do the colonoscopy?
I do colonoscopies,
Okay.
so they can be done by either a gastroenterologist or some surgeons do them. And
Okay.
I myself, I like to focus on colorectal disease, so I do perform colonoscopies.
Okay.
as
So when
well.
you're doing that, okay, this is where you're able to see what's going on. So tell me how that procedure works.
So essentially, like it's been alluded to, you do a prep, and like you've said, that's the worst part of the procedure.
Yeah.
On the colonoscopy, you have a camera, you can see the entire wall of the colon, okay? And if you see something suspicious, a lot of times we can look at something and say that looks tumor is, because it's very different than the normal mucosa or the inner lining of the colon. But what we do to be certain is we can take biopsies through the scope. The biopsy is sent to the pathologist, they do their studies on it, and they can tell us whether it's a cancer or not. And so we don't technically have a stage at that point, but we know there's a cancer there. Staging's, it's not too terribly complex, but it's multifaceted. One of the first things we do after a tumor is found is we often will do imaging studies, like a CT scan of the abdomen and pelvis. And they're going back and forth whether you do include the chest in that now or just do a chest x-ray. But essentially you're looking for, is there any sort of spread of the disease? There's also some blood tests we can check to see if there's any activity from the liver, because that's typically where the colon cancer spreads to first, is to the liver. So that's kind of your initial staging workup. Unfortunately, you don't have your final stage until that section of involved colon is removed. What we do is, once that section of colon is removed surgically, the pathologist will look at it. They can tell which levels of the colon are involved, and then they also count the lymph nodes from the area that we've resected as well. And that'll get you your final stage, and that'll determine whether you need further treatment or whether excision was 100% successful in removing the cancer.
Okay, so when you're doing the procedure, okay, if there's a polyp there, you take the polyp out, right?
Yes, if there's a small polyp, it's usually amenable to complete resection through the scope. Yes.
Are they all tested, every polyp tested, or?
Every polyp that's taken out is typically sent for pathology, yes.
And how long does that take?
Usually I tell people, give us a couple days to let them run they have to stain them and look at them under the microscope.
But from your, sometimes a surgeon could, I mean, not that you're dead on 100%, but you have a pretty good idea of whether that is.
When it's made that transformation from simple polyp to tumor, it's pretty, you can usually tell by looking at it, yes.
So here again, getting a colonoscopy, it's important, because I think what happened with this lady who saw the show, what I did with Dr. Yamula, was the fact that she figured, she has some discomfort, and she went for the colonoscopy, and that's when they discovered that. And it was,
right. Dr. Hotchner had already kind of spoken about that. Unfortunately, a lot of the early cancers have no symptoms. You don't know that you have it, and that's the time you want to find it, because that means you have the best chance of cure.
All right, so the bad news is you find something, okay?
Mm-hmm.
So what's the good news? You got to give me some good news here.
The
Mike.
good news is colon cancer is very treatable, especially early stage disease. And there's a lot of different treatments, even for later stage diseases, that can help give you a good 5-year or 10-year survival rate. Mm-hmm. Again, if you catch the tumor early, sometimes surgery alone is curative, and there's no further need for any other treatments. If you do have a little bit more advanced stage, and that's when I send the patients to somebody like Dr. Hotchner, who has other like chemotherapy agents and whatnot that they can use to help decrease the chance of any residual tumor spreading and hopefully eradicate the disease itself.
So how does that, I mean, so what is the success rate then when you find that and they come to you, Harvey?
Well, it depends on the stage. So if you're a stage 0 or 1, surgery alone is curative. You're probably about, say it's about a good 70% chance that it won't come back. What we look at so basically we look at 3 things. We look at the depth of penetration of the tumor through the colon. We look at the lymph node status, and we look at spread to other diseases, and that gives what we call a stage. If it's involved in the lymph nodes, then we call that a stage 3. We know that without that, it's curative. Surgery is curative in the sense that it takes out all the gross disease. But statistically, we know that there is approximately about 30 to 40% chance that it may come back at a future date.
Even with chemo?
No, we didn't get to the chemo yet.
Okay, I'm sorry. Okay.
So the studies were done and showed that if you give what we call adjuvant treatment, which means added to the surgery, that you increase the cure rate a good 20-30%. It's not 100%, but you definitely put the statistics in the patients in favor. So you usually give people treatment for about 6 months. It's usually 12 treatments, and after that you watch them. If you're at more advanced stage 4, means that it's spread to another organ. It's not curative. It's not curative, but it's treatable. And we have multiple lines now of chemotherapy with new biological agents where people can do very well for an extended period of time.
So that would be the treatment after the surgeon has said,
Correct.
you know, and you know what different stages are, could say. Now, let's talk about chemo, okay? There's been a trip, now, correct me if I'm wrong. Has there been a great advance from chemo that was many years ago as to
Right.
now?
We've gone from chemo, what we call chemotherapy, which is toxic chemotherapy, to biological agents. So oncology is becoming a real modern science where we find where the abnormality is within the cell, where the genetic abnormality is, or the chemical abnormality, and now we have drugs that are geared towards that particular abnormality. So we have, on colon cancer, we have 2 major drugs that we can add. This is for people with more advanced disease. We have a drug called Avastin, which interferes with blood vessel formation. And then we have a whole group of drugs which interferes with growth factors, epithelial growth factors that actually will turn the cell off from growing. So we have more, before we had only 1 or 2 drugs, now we have multiple lines that we can treat people for.
So the whole thing, going back to this, Dr. Mahoney, is the fact that the mere fact is that you get your colonoscopy, okay, period. Don't even no symptoms, etc. Hit 50.
Normal people, age 50, sign yourself up. Find somebody that does it. Your primary care doctor can steer you towards somebody. Otherwise, you can find either myself or the GI group, and they'll set you up.
If a person needs surgery for colon cancer, what usually is the recovery time?
It's kind of a dependent on the situation sort of thing. A typical person, I try to do the procedure laparoscopically when I can, through the little incisions. And that significantly decreases your recovery time. Usually you're in the hospital for a few days. On the short end, like 3 days, you're in the hospital. Average, I would say 4 or 5 days, and that's just recovering from the surgery, just getting comfortable, getting bowel function back. And then after that, you're at home, you're just kind of taking it easy. Most people can get back to a regular diet fairly quickly. And essentially the only restrictions you have after laparoscopic surgery is light duty. So no heavy lifting. And that's for about a month to 6 weeks.
Terrific. So folks, we have a lot of good news here for you, right? So the idea is prevention is the most important thing, as you know. And folks, it took me 3 years before I went for my colonoscopy because I'm a big baby, as you know. I go and see Dr. Evans, right, for some blood work I had to get done. Anyway, the girl takes my blood pressure. She says, "Oh my God, your blood pressure is to the roof." I says, "Don't worry, that's the way I go for my eye exam and my blood. That's the kind of big baby I am." Folks, I'm talking to Dr. Hotchner and Dr. Mahoney. If you want to get in touch with them, 570-5014-LVH. We come back, we'll do a wrap-up in case you missed something of importance to save your life. Stay with us. Back to the Sam Lesante Show. Remember, folks, in the Mountaintop, Wilkes-Barre, Kingston area, we're on Channel 92, Service Electric Communications. We show our shows Saturday and Sunday evenings from 7 to 11 p.m. My guests today, Dr. Hotchner and Dr. Mahoney. We're talking about colon cancer, and we got a lot of good news for you. So a review, Doctor, the rate in this area is high. What should we be doing?
Just screening. I mean, like I said, good healthy diet is good in general, so you don't get any other diabetes, high blood pressure, hypercholesterolemia. But you need to have a screening colonoscopy, or if you have developed any symptoms, to go immediately to your doctor and not sit and wait. If you have symptoms like constipation or diarrhea or weight change, go earlier the better to find an early disease and make it more curable.
And so when you're doing your colonoscopy, Dr. Mahoney, you're knowing what's going on. It's not a piece of cake, but everybody have a lot of people sometimes are concerned about the colonoscopy itself, that maybe something may happen. Okay, what are those chances? Extremely
low. The reason colonoscopy is considered right now the gold standard in screening is because it's a low risk test. It's not 100%. Nothing will go wrong, but it's extremely rare to have a complication from colonoscopy.
And here again, when you do find something, okay, you have the whole system working for you, which, I mean, the Lehigh Valley Health Network is amazing. I always say if something happens and you go to, you got this great guy here, Dr. Hotchner, so you have experts, and then if you need more help, you got Sloan Kettering, you got tons of people you can refer to. So it's not only one opinion, it's 10 or 15 other opinions, don't you think?
Yeah, I think we have a good base set of people with the resources to give just about everybody that has this disease process the treatment options that they would need or require. Very rarely would we have to do anything different. I think with the skill set in the area for colon cancer, I think we're pretty set up well.
And when I spoke to you before, you're a general, I mean, you not only do colonoscopies, but you do general surgery. Correct?
Yes, I'm a general surgeon.
Yeah. Anything you'd like to specialize in?
I like the minimally invasive colon work. That's kind of my favorite stuff. So that's kind of the area I like. But I do all general surgery: hernias, gallbladders, acute care like your appendix and blocked
just
bowels.
do them all, right?
I jump in.
And you do a great job. You guys are doing a fabulous job on the Beltway. You and Dr. Evans, I really, and your crew up there.
Yeah, we do.
You have a great reception crew. It's all the nurses, and they all work together. It's very,
do.
and
We
it's
have
important
it's a
because, like I
family.
said, people come in that are nervous, they're scared. It's good to have that comforting, and you don't need a grouchy person to scream at you. But you guys have great bedside manners, and I want to compliment you. It's always nice having you on the show. Okay, you got 2 times. You can come back home and
All right,
yourself a thought. Folks, colon cancer is nothing to laugh at, but however, the point is it's a serious matter. We can save your life. We can save your life. You're 50 or over, make sure you call your family doctor, get a screening. Believe me when I tell you, it could save your life. So do that if you're 50 or older. We'll see you next time.